All right. Knock, knock, knock. Hi, my name is Deborah. I'm going to be your nurse today. Can you please tell me your name and your date of birth?
Yeah, Deborah.
Okay, and then can you please tell me why we're here today? Right. So in order for me to get started, with the physical assessment, your head-to-toe assessment, I'm going to start off with the general appearance. Patient presents today as slim and fit with her physique. She doesn't show any signs of discomfort or distress. Her facial features look symmetrical. She is sitting in an upright position, and her posture is erect. She's not leaning from more to one side or another. Now I'm going to go ahead and ask you a question. Can you tell me what you have for breakfast this morning? And can you tell me which street you grew up on? Okay, and then can you tell me which day of the week it is? So the patient is alert and oriented times 4 to person, place, time, and situation. Her long and short-term memory is intact. Can you go ahead and put your arms out for me? And with your right hand touch your nose, and left hand touch your head, and yes, go ahead and do that. The patient is able to follow commands and using active motor movement. Her Glasgow Coma scale is at a 15 because she is fully alert and awake and responsive.
Do you have any difficulty with frequency, pain?
So now I'm going to hop into your psychological portion of the head-to-toe assessment. The patient's facial features are appropriate because she's able to maintain eye contact and she's smiling. The mood is also appropriate because she's cooperative, which is how it should be for the situation. Her speech is articulate, and she's able to maintain conversation, which is development of the appropriate age, and her hygiene appears to be clean. So now we'll get into the cranial nerve. Cranial nerve 1 is the olfactory nerve, and that is for smell. So I'm going to have you plug one side of your nose, and I'm going to have you smell an object, and you tell me what you smell. But close your eyes, plug your nose, and tell me what you smell. Plug the other side, and tell me what you smell. Great. So for cranial nerve 2, the optic nerve, that we will be using the Snellen chart. So I would basically just stand 5 feet away and have you use the Snellen chart. For cranial nerve 3, 4, and 6, we're going to test at the same time. So I'm going to go ahead and have you follow the pin with your eyes.
It's 4 range of motion up her neck. Now her shoulders. Yeah. Go ahead and put your arms out straight, and then all the way back. Wrong circular motion.
Okay, and now I'm going to have you cover one eye, and I'm going to flash the light in.
Flex your elbows.
Cover your other eye.
And then a circular motion of your wrists.
Okay, patient's eyes follow Perla because they are the pupils are round.
Full range of motion, and then checking your knees.
Equal, reactive to light, and
your ankles, circular motion,
round, reactive to light, and accommodation. And extra ocular movements also are intact. So now we're going to hop right into cranial nerve 5, which is a trigeminal nerve. I'm going to have you open your mouth so I can feel that your mandible is in proper place. Go ahead and close it. And then go ahead and close your eyes and tell me where you feel pressure. On your face.
Left. Same to the other side. Left. Perfect. Okay, we want to sit up for more skull scale.
Cranial nerve 5 is intact. Cranial nerve 7 is the facial nerve. So can you go ahead and come to your and then smile and raise your eyebrows. Cranial nerve 7 is intact. Cranial nerve 8 is the vestibular procedure. And this is for hearing. So I'm going to whisper 3 words on each side of the ear, and you let me know what you hear. Okay, cranial nerve 8 is intact. Cranial nerve 9 and 10 can be tested together. This is the glossopharyngeal nerve and the vagus nerve. So go ahead and open your mouth and say ah. Uvula is midline. Go ahead and swallow. Okay, cranial nerve 9 and 10 is intact. Cranial nerve 11 is the spinal accessory nerve. So I'm going to have you show your shoulders against resistance. Go ahead and try. Okay. I'm also going to have you turn your head to test your neck for resistance. So go ahead and turn your head to your left against resistance, and the other way. Cranial nerve 11 is intact. Cranial nerve 12 is you have the glossal. Go ahead and stick out your tongue and wiggle it from side to side. The tongue is midline, and if it was to hang to one side more than the other, then the opposite side that it hangs would be the weak side. So, those are the cranial nerves. I'm going to get into your head, face, and mouth. I'm going to go ahead and palpate the head area. And I don't feel any abnormal lumps or lesions or masses. Do you feel any pain or tenderness? Okay. So the face is symmetrical, the head is symmetrical, and the hair is evenly distributed. It's long and thick and healthy, and I don't see any signs of infestations or like psoriasis and dandruff. And so I'm going to go ahead and check your mouth next. If you can go ahead and smile. All the teeth appear to be there with no plaque, and the gums are pink and moist. I don't smell any foul odor, so everything is good with the head, face, and neck. The next thing I'll check is the skin and the nails. So her skin tone is tan, which is appropriate for her ethnicity. It's a light tan, and I'm gonna go ahead and feel for her temperature. Temperature is warm and evenly distributed. Her skin texture is smooth, and I don't see any dryness, like flakiness to the skin. The next thing I'm going to check is the soles of the palms of the hands. I'm looking for thickness, which is appropriate for this area, and I would check that on the soles as well. And I'm going to check the ankles for edema. And then I'm also going to check, there's no signs of edema, so I'm also going to check the hands for turgor. And the skin is elastic, there's no signs of tenting, no signs of dehydration. And I'm going to check the nails for clubbing, and there's no signs of clubbing. I'm just going over the and the cap refill is less than 2 seconds. I don't see any signs of jaundice or discolorations of the skin. So what I'm going to do next is check on your pressure points. If I can have you bring down, everything down, and then roll over to your right side. There is no pressure injuries to the occipital, the shoulders, the spine, the hips, the ischial tuberosity, the sacrum, the inner and the outer knees, the inner and the outer ankles, the heels or the toes. Okay, you can sit back up. The Braden scale is at a 23. She's independent, she's not incontinent, she's not bedridden, she's not at risk for pressure injuries. Next, we're going to get into the respiratory system. Upon initial inspection, I don't see any signs in the lips of cyanosis. She's not using her accessory muscles, and she's not leaning in a tripod position. So I'm going to check your chest extension. When you feel my hands in the back of your lungs, go ahead and breathe in deep. Okay. Chest expansion is equal and bilateral. So what I'm going to do next is auscultate. This is what we're going to listen to me here at the back. I'm listening for adventitious breath sounds such as wheezing, bronchi, because it's so spread out. Wheezing, bronchi, crackles, braille. Me too. I was gonna I'm heart failure. And then everything goes. Well, that's spread it. Spread it when it's it's clear to auscultation in the back. I'm going to listen to 4 areas in the front, 1 above the clavicle, 1 below the clavicle, the same thing on the other side. And it is clear to auscultation in the front as well. I'm going to get straight into the cardiac. So I need to listen to certain areas of the heart. So I'm going to start off by listening in the sacrointercostal space on the right hand side, and that is going to be the pulmonic valve. I'm listening with my diaphragm. Whooshes or bruits or murmurs. So now I'm going to go in with the bell on the same areas. S1 and S2 sounds are distinct. Pulmonic, herbs point, tricuspid, and okay, heartbeat is strong and rhythmic. So now I'm going to go ahead and check peripheral pulses. I'm going to start off with the carotid artery, and I'm going to do this unilaterally. Heart rate is strong and rhythmic. And the same thing, I feel a strong and rhythmic heart rate. I don't see any distended veins or anything like that. Now I'm going to check bilaterally your radial pulses.
July 12th, 2002.
Okay, so everything matches.
And the heartbeats are regular and rhythmic on both sides. They are matching. Now you can lay down. I'm going to check or putting this in. No, I don't think so. So you can lay down. I'm going to go ahead and check your dorsalis pedis, which should be right here on both sides. Heartbeats are strong and rhythmic. And I got to check the posterior tibial on both sides.
Oh, no signs of any discomfort.
And they are even, equal, strong, and rhythmic.
Okay, so you can go ahead and sit back up.
Additional pulses that can be checked but skipped over would be the brachial, the popliteal, and the femoral arteries. As mentioned earlier, there's no signs of edema, and capillary flow is 2 seconds. So now I'm going to get into your abdomen. So if I can have you lay back down.
Ask your questions about your memory.
And upon initial inspection, there is no protuberance, there's no rounding, so everything is flat and normal. So I'm going to go in first and auscultate the 4 regions of the abdomen. We're going to start with the lower right region and work our way
That should be in the beginning.
right lower quadrant.
So after I do memory, I have whatever. Okay.
Upper right
Um,
quadrant.
Where we're at.
The NICF has a date. December 9th, 2024.
Lower left quadrant is lower, and I hear normal hyperactive vowel sounds like gurgling and clicking. Now I'm going to percuss those same areas. Lower right quadrant, and I should be hearing timpani in the airfield and dullness in the visceral organs.
So cranial nerve number 1 is intact.
And now I'm in the left upper quadrant, and I'm looking for dullness.
And close your right eye.
And I'm looking for timpani in the left lower quadrant. And everything is good. So now we're going to go ahead and go in with the light palpation. Right lower quadrant.
Nope. Okay, so
Looking for any abnormal swelling or mass.
do you feel any pain?
Okay. Now I'm going to go back in a little deeper. This area, we would be able to feel the appendix if it was inflamed. We have the liver over here. We have the stomach over here. And we have the descending colon and the anus over here. And the bladder is there too. Okay, you can go ahead and sit up. When was your last bowel movement?
Are equal now reactive?
Okay. How is your appetite? Do you have any issues with nausea or vomiting after eating? No? No, okay. And then how about, do you have any issues with constipation or diarrhea?
Okay,
So now moving into the vaginal and bladder. So do you have any discoloration or inflammation in the vaginal area? Do you have any pain, irritation, or discharge during urination?
Oh yeah, we want
And how's the frequency? Are you regular, incontinent? Frequency is normal. Okay, now we can move on
going
to the musculoskeletal system. And the first thing I'm going to check is range of motion. So if I can have you stand up, can you touch your right ear to your right shoulder, left ear to left shoulder? Have you come over your neck and your circumference? Okay, now we're going to check for your shoulders. If you can move your shoulders forward, bring your arms back behind you, and do a circumcision. Okay, now let's test your elbows. Go ahead and lift your elbows, extend your elbows. And then as for your wrists, go ahead and put them downwards. Okay. So having you lay back down. And I'm going to move your knees up and back down. Same thing for this leg, up, back down. So I'm going to move it up and have you keep it there. And we're going to cross this leg over that leg and bend your knees. And the same for this leg. Perfect. Now go ahead and put your legs straight and wiggle your ankles for me. Okay, range of motion is intact. So if I can have you stand back up one more time. Now we're going to test the skeletal strength. And I already tested the neck and shoulders earlier when we did cranial 11. So I'm going to hop right into the arm strength. And I'm going to push down. Do you go ahead and give me resistance? Okay, and I'm going to come from underneath push up. Give me resistance. Okay, good. Sit down. I'm going to do the same thing to your legs. When I pull forward, give me resistance. And I'm going to push on them. Give me resistance. With it. Go ahead. Give me resistance when I push down on your ankle. And then push on my hands like that. Okay. Muscle strength is 5+ bilaterally. And the last thing I'm going to do is check her gait. So if I can have you stand up and walk a few steps back. And walk back this way. The gait is even. She doesn't shuffle or have any limps. The weight is evenly distributed, and her foot placement is where it should be. And I don't have any abnormal findings at this time. That is the end of the assessment.
Hello, so we're doing the head to toe assessment, and then...
Hi, I'm Liz Alamo, and I am over the age of 18 and consent to being videotaped.
Okay, so now we're going to begin. So to begin...
Come in.
Alright. Hello, my name is Jesse Nunez. I will be doing your assessment today. We're just going to be running through a bunch of different body assessments and stuff like that. Can we start off with your first name, or your full name, and then date of birth?
Yes, it's Liz Alamo, and December 14th, 1999.
Okay. Do you have any allergies that I need to be aware of?
No.
Okay, so upon looking at the scene, there are no safety hazards, there's nothing on the floor, the bed's in the lowest position, the brakes are locked, and the side rails are up. In the meantime, is there anything that you may need? Do you need a blanket or anything like that? No? Okay, so to begin, what I'm going to have you do is get up and walk over to the wall and back. Okay, see. So your gait is smooth, rhythmic. Did you feel imbalanced at all?
No.
No? No issues there. Okay, so I'm just going to take a seat here. Alright, if I had my book with me, I would be documenting. So what brings you in today?
I have upper back pain.
Upper back pain, okay. So when did this back pain start?
I did have back surgery in 2014, but it only really started like 3 years ago.
3 years ago? Okay. How would you describe that pain?
Like a sore feeling.
Okay, a sore feeling. So on a scale of 0 to 10, 0 being no pain, 10 being the most painful experience you've had, how would you describe it?
Maybe like 6 or 7.
Okay, 6 or 7. Is there anything that makes that pain go away? Makes you feel better?
Sometimes I'll take over-the-counter painkillers.
Over-the-counter painkillers, okay. Is there a usual timing to this? Does it start in the morning? Does it...
No, it only gets worse if I do high-intensity workouts or if I'm standing for too long.
Okay, so then that makes it worse if you... Okay, that makes sense. Does it move at all, or does it usually stay localized in where your surgery was?
It stays localized.
Okay, all right. So now I'm just going to be doing a couple of assessments. Do you have any questions regarding any of them? No? So in the beginning, I'm going to be inspecting and palpating your face and skull. To begin, I'm going to inspect, and your face is symmetrical. Would you mind raising your eyebrows for me? Okay, relax. Your skin is appropriate for ethnicity. Upon palpation, there are no lumps, scars, anything like that. Did it hurt at all when I palpated? No? Okay, so to begin, we're going to be doing your eyes. I'm going to be looking at your eyes, okay? So upon inspection now, your pupils are round. And I would usually use a pen light for this, but given the circumstance, I have a phone light, so I'm going to be using that. So I'm going to dim the lights a bit. So I want you to look directly over my shoulder, and I am going to be running my light across each of your eyes twice. This is to look for direct and consensual light constriction. Keep looking straight. All right. Direct constriction. Consensual. Okay, I'm going to switch sides. Keep looking straight. Okay, direct. Consensual. Okay. So, like I said, your pupils are equal. They're round. They're about 3 to 5 millimeters apiece. They're reacting to light, so that's good. And now we're going to assess your accommodation. So I'm going to ask you to look at my fingertip and just follow it, okay? All right, so upon doing the assessment, your eyes constricted and converged when I got real close to your nose, and then they dilated and diverged when I went away. Okay, so then next up, I'm going to be palpating your correction. I'm actually going to be inspecting your mouth, and I am going to ask you, do you have any dentures, loose teeth, anything like that? No? If you would, just say cheese. All right. Can you pull your bottom lip down anymore? Okay. It looks pink, no blood, moist, so that's good. Next, I'm going to be palpating your carotid artery and assessing for JVD. So upon inspection, I see no jugular vein distension, which is a good thing. Now I'm going to be palpating your carotid artery. All right, so on that side there is good amounts of strength. I would say about 3+, and it's rhythmic. Same on this side. Okay, now I'm going to be palpating your trachea. Seems like it's in the center. There's no swelling or edema. And it's about midline. So that is good also. Okay, so next up, I'm going to be inspecting your upper extremities. Okay, and so in order to do that, I'm just going to ask you to your arms. So upon inspection, skin is intact. There is no scarring or lesions. Upon palpating, it is warm. Let me know if you feel any soreness or tenderness. So there are no lumps. Okay, we're also going to check that side. Okay, so together, hold your hands up for me. Now I'm going to cross my fingers, and I'm going to have you grab on and then squeeze as hard as you can, okay? All right, so you are Equilaterally, bilaterally, you are equal in strength. I would say about a 5+, so it's good amounts of strength. I'm going to be assessing your pulses now. Alright, so rhythmic and about a 3+, it's bounding, it's good. And now I'm going to check your cap refill just on each side. Alright, so that is less than 3 seconds for your cap refill. I'm going to check your pulse on this side also. Okay. So it is 3+ on both sides, and bilaterally the cap refill was less than 3 seconds, so that is good as well. Next up, I'm going to be inspecting your chest. So upon inspection, I see that the skin is appropriate for ethnicity. There are no scars, lesions. There is no abnormal hair distribution, so that is also good. So I'm going to be inspecting from the front and then from the side. So it should be about a 1-to-2 ratio, which it is. And upon inspection, I also see no use of accessory muscles, so that is good. You have no issues breathing at all. Everything sounds great. So next up, I'm going to wipe down my stethoscope because I'm going to be auscultating your respiratory sounds. Okay. Now, before I continue any more, do you also have any more questions? All right. So, anytime I move on a spot, I'm gonna have you take a deep breath in and out through your mouth. Right now, I'm gonna palpate for your clavicle. And while I do this assessment, is it okay if I reach into your bra at certain points? Okay. All right. In through your mouth, up through your mouth. Okay. So in order to do these next few steps, I may have to go in a little more, and then I'm gonna have you lift your breasts at the end, okay? Deep breath. Begin. Okay. So, like I said, I'm gonna have you lift up just a little bit. Alright, deep breath. Okay, on the side. Okay. Alright, so now I'm going to be listening to your posterior side. So if you would just lift your legs up onto the bed, it's a crisscross applesauce. I'm going to move your hair to your front a little bit. There you are. Now once again, I'm just going to move the stethoscope, and each time take a deep breath in and out through your mouth. Alright, upon auscultation, I did not hear any adventitious sounds. Your breaths sound rhythmic, so that is also very good. I'm going to be assessing your heart sounds again, so you can put your feet back down on the floor. Now, when I do this assessment, I may stop in a particular spot, but don't get alarmed because I'm just going to be taking your apical heart rate. So in the process of doing that, please do not speak or anything, okay? Okay, again, I'm going to be going in just a little bit, okay? Okay, and now I'm going to ask you to lift up on your left side of your breast. Thank you. So since I'm able to hear it a little better at Erb's point in the middle, I'm going to be doing my apical pulse up there, okay? So your apical rate was about 75 and it was rhythmic. S1 and S2 was heard in all 5 spots. It was just easier to hear at Erb's point, so I used that for my apical rate. So yes, 74, which is good, it's within range. So that is perfect. So now I'm going to have you lay down with your head up here and your feet down there. So in order to do this part of the inspection, I'm going to have you drop the top portion of your waist, or of your shorts, down to just above your iliac crest, which is your hip bone. So that's perfect there, and then your bra is in a good place already, so there's no need to move that. Upon inspection, I do not see any abnormal hair distribution. In the meantime, are you comfortable where you are? Do you need anything to drape you over or anything? Okay. Like I said, no abnormal skin lesions, no abnormality scars. Upon looking at contour, it is flat, which is a normal finding. And then next, I'm going to be listening to your bowel sounds. I'm going to move it every time I hear a sound, and then I'm going to take that into account when it comes to a mimic. So I actually heard 4 bowel sounds within 10 seconds. So if I do that math, it'll be about 24 bowel sounds in a minute. So that is within range. Next, I'm going to be palpating. Let me know if you feel any sorts of pain or anything like that, okay? So I'm going to palpate 4 times in the upper right quadrant to compensate for your liver size. Okay. So since you're already laying down, what I'm going to do is assess your pedal pulses and your ability to use your lower extremities. In the meantime, I'm going to palpate your lower extremities and just feel for any soreness, tenderness, edema. So let me know if you feel anything, okay? So upon palpation, your lower extremities appear to be warm, no edema, no pitting edema at all, and your muscle tone is equal bilaterally, so that is good. Now I'm going to be assessing your pedal pulses. So your pedal pulses appear to be 2+ bilaterally, which means that they're normal, which is a good thing. So now I'm going to ask you to press against my hands. Okay. Back up. All right, so that is good. Next up, I'm going to ask you to now lift your knee up to your chest. All right, your other knee now. All right, both range of motions seem good. I'm gonna ask you to raise your feet up one at a time now, up as high as you can. Okay. All right. So those both appear to be good. So, yeah. So now I'm going to have you sit back up. So now just one more thing, I'm going to be assessing the range of motions in your arms, okay? So, arm, okay. So now I'm gonna have you push against my resistance, okay? Good. All right, bilaterally that is good. Now I'm gonna assess your shoulders. All right, that is good. Now I'm just gonna have you go like this, just to assess your range of motion. All right, and everything seems to check out in that department. So now I'm gonna have you stand up and then take a glass of water and take a drink. You can go ahead and bring the drink right back over here. Okay, and then I can take that from you. And I think that would be all. So the doctor will be in with you soon, okay?